Call a meeting to order. I think Grinberg's here, yeah. Okay. Sorry about that. Trains in Moorhead. This is a special meeting held in regards to the health insurance plan. Bruce Grubb to explain with Jill Nett.
Yeah, I'll have Jill come up and give the entire background to this. Kind of strange to have a special meeting on this date in history, but we're up against a November 1st deadline, which helps explain this. So this is related to city's health plan. Currently, we're on the North Dakota PERS plan provided by Sanford Health, obviously, and Jill has recently received a couple of updated proposals for your consideration. So with that, Jill, if you would, thank you.
Mayor and Commissioners, thank you for your time today to discuss our health insurance offered to City of Fargo employees. As you all know, we are currently covered under the North Dakota Public Employee Retirement System Plan, or ND-PERS, which is insured by Sanford Health Plan. Back in 2012, the city transitioned from a self-funded plan to ND-PERS. And during our time with ND-PERS, the plan was initially insured by Blue Cross and Blue Shield of North Dakota, and since 2015 has been insured by Sanford Health Plan. So we've had a very good relationship and experience with ND-PERS and with both insurers, both Sanford Health Plan and Blue Cross and Blue Shield. And I just want to acknowledge that we do have representatives from both Blue Cross and Blue Shield and from Sanford Health Plan here with us today. So I want to thank them for their work in putting together quotes for the City of Fargo and presenting that information. So earlier this year, representatives from Blue Cross and Blue Shield had requested a meeting to discuss some potential savings for the City of Fargo in regard to our health insurance. And earlier this month, they presented their quote to us. So in addition, during that time, we also requested a quote from Sanford Health Plan and received that quote last week and ultimately received the finalized numbers just yesterday. So again, we appreciate your time in coming together for a special commission meeting today. Both of the quotes offered by Blue Cross and Blue Shield and Sanford Health Plan provides substantial savings for the City of Fargo and for employees. So we wanted to get them in front of you quickly for your consideration. It's important to note that both of the quotes that we're going to discuss today provide the same plan design as our current health insurance under the ND-PERS plan. So the deductibles, the co-payments, co-insurance, out-of-pocket maximums, all of those remain as they are today. No changes in the plan design. And that's important. If we were to transition from ND-PERS to a separate group with either insurer, we'd want to maintain our grandfathered status of our current plan. And so keeping the same plan design is an important component of that, and also our current cost-sharing structure with our premiums for the portion that the city covers and the portion that employees cover is also an important component in maintaining the grandfathered status of our health plan. Again, we'll talk in more detail about that in just a minute. Mayor and Commissioners, you have a spreadsheet in front of you that provides a side-by-side comparison of the current premiums under ND-PERS and the premiums quoted by Blue Cross and Blue Shield and by Sanford Health Plan. And I'd like to take a few minutes just to walk you through the details included on that spreadsheet. So at the far left-hand side, you can see the current enrollment of our full-time employees, and we pulled these numbers just based on last pay period numbers. So right now we have 335 employees who have elected single coverage and 404 employees who have elected family coverage. And this includes just our full-time employees, so those scheduled 40 hours per week. The next column over shows the current premium cost share structure, and again, it's important for us to maintain the cost sharing structure for premiums. So you can see for single, the city pays approximately 86% of that premium. For family, the city pays approximately 72% of that premium. The first section shows our rate structure under ND PERS. So our current total monthly premium for single is $638.38, and for family is $1,542.40. And based on those cost-sharing structures, then you can see on a monthly basis what the employee share equates to and what the City of Fargo share of that premium is. So down below the table, you see that our premiums annually are just over $10 million. So moving to the right, again, we have the Blue Cross and Blue Shield quote in blue, and in kind of a yellowish orange here, our Sanford Health Plan proposal. Under Blue Cross and Blue Shield's quote, the single plan would be reduced to $419.30 per month, and the family plan down to $1,014.70 per month. And so again, maintaining that same cost share structure with the city paying 86% of single, 72% of family, you can see how those premiums would be impacted by a transition to Blue Cross and Blue Shield. So the total new premium annualized would be $6.6 million under the Blue Cross and Blue Shield proposal. When we look at the difference between our current plan and the quoted plan, we would experience a total premium savings of just over $3.4 million. Based on the cost-sharing structure, the city would realize over $2.5 million in savings based on that plan. And again, this equates to a 14% premium savings. And I just want to note down below the impact to our employees. The employee monthly saving for a single plan would be $30.68. For a family plan would be $147.76 for our employees on a monthly basis. Then looking at the Sanford Health Plan, again, Sanford quoted savings as well. You can see the new total premiums would be $593.06 for single, $1476 for family. And again, based on the same cost-sharing structure, we've calculated that into an employee share and the city share for both single and family levels. The annual premium with Sanford Health Plan would be just over $9.5 million. And so that would result in a premium savings of over $500,000 total. The city would realize $385,000 plus of those savings, and that in total is a 5% reduction from our current premium structure. Down below, again on the spreadsheet, you can see the savings for our employees under the Sanford Health Plan proposal. Our single enrollees would save $6.36 per month, family enrollees $18.37 per month. One thing I want to note on both of the proposals is what would happen in year two if we did transition under either plan. So under Sanford Health Plan, there's a 0% premium increase for 2019. So the rates quoted would remain in place for that 2-year period. Under the Blue Cross and Blue Shield plan, they would set a 7% increase cap for 2019. So in other words, if we experience an increase for 2019, it would not exceed 7%. Do you have any questions on the numbers that either plan has proposed?
Commissioner Greenberg?
I don't. I just explain to me why. I mean, it's pretty stark and black and white, the decision, significant savings to the city. I'm not sure what your intentions are to have other remarks for our staff, their comments on the change in plan, but I'd be curious to know, why the hard stop deadline of November 1st when this plan goes into effect January 1st?
Yes, so under ND PERS, our contract with them requires a 60-day notice if we were
Okay.
to transition from ND PERS to another insurer. So that's why we've had to move fairly quickly here with calling a special meeting. We would have a November 1st deadline to notify ND PERS, either if we were transitioning to either of the insurers.
Okay. And my second question is what I shared with Mr. Grubb here recently. With what is going on in Washington, the changes of what we understand today might be healthcare reform. What is the likelihood in your experience, or if you followed it, that there are any impacts to this switch with whether it's Blue Cross or staying with Sanford, of what could be coming? And I know that's a big question. Any sense of, will this impact at all this plan because it's a private plan, or is it more based on the healthcare exchange with the folks that are underinsured or not insured?
Yeah, so keep in mind, I'm not an expert on the Affordable Care Act, and it is hard to predict changes around the corner, but my understanding with the most recent changes is that they don't impact the decisions we're making here today, that they wouldn't have an impact on us as an employer group. And so, as long as the regulations are as we know them today, our biggest concern or question going into a transition would be maintaining the grandfathered status of the plan. And with either of the plans, because of mirroring the current plan design, as well as if we move forward and maintain the premium cost sharing structure, it's our understanding we would maintain that grandfather status within the current plan.
To include any of our employees having pre-existing conditions would be covered with the transition?
Correct. So our current enrollees would be able to roll over onto the new plan, and we would hold an open enrollment for other employees who perhaps had declined at their first enrollment, but might want to reconsider coverage now based on the new premium cost sharing. So we would have an open enrollment for that group as well.
Mr. Strand?
Thank you. Jill, did you say we would be hearing from representatives, perhaps from Sanford and Blue Cross today as well? Or are they just here present?
They're both
So
here.
they are here and present. I've not asked them to formally present, but certainly if you have questions, I'm certain they'd be willing to come up and answer any questions that you have.
I would invite them just to say a few words, if you wouldn't mind, with us.
Yes.
Who do you want to start with?
Whichever gets there first.
I've never been shy. Mr. Mayor and members of the commission, thank you for the opportunity. My name is Pat Belmore. I'm from Blue Cross Blue Shield. I'm part of the executive team, specifically our chief marketing officer. So again, appreciate the opportunity to come here and have a conversation with you. As you know, we have a lot of experience administering a lot of employer-sponsored plans around the state, ranges from full, large national accounts all the way down to little mom-and-pop stores with 2 employees, and we've got experience that runs the whole gamut, whether it's on a fully insured basis like what we're talking about here, or in larger accounts where they might be in a kind of a self-funded arrangement. Either way. One thing that we're very proud about in terms of the level of service that we're delivering to our customers, and a lot of that can be called out in the fact that not only this year but past years, but specifically this year, we're running at 99.4% of all of our employer groups have renewed with us throughout the year, and that's exceptionally high when I talk to my counterparts in other states around the country. So it speaks well to the dedicated amount of work that's being done by our staff back at our offices. We are a Fargo-based company. We'd be proud to represent and work hard every single day for your business. To me, this is really a pricing exercise at this point. The real work becomes after this, where we dedicate ourselves not only to delivering top-notch care, but also what can we do to get more involved with the city and helping drive and really understand all the data that goes behind your healthcare costs, and what can we do to affect that change.
Thank you.
Mr. Mayor, Commissioners, thank you for having a meeting today. I'm Jimmy Schneider at Sanford Health Plan. For 17 years, I've been responsible for the sales and marketing of all lines in Sanford Health Plan, which means I get to deal with individual health insurance, med sup, large group, small group, and everything. Your question, Commissioner, earlier about recent developments with the ACA, just to back that up, the cost-sharing reduction that went away a week ago pertains to individual health insurance and doesn't have any impact on the large group policies that we're talking about today. The great thing about the Sanford proposal, first thing is you always want minimal disruption whenever you talk about making a benefit change to a group of employers, whether it's 2 or 1,500. The idea with being on Sanford Health Plan currently is you're already in our system. So the migration to your own separate plan as the city of Fargo, that work is pretty much already done. We have all the membership information loaded. We know who everybody is. But more importantly, you have employees and they have family members who are already working with Sanford Health Plan in the care management area, getting help with pharmacy questions, getting help with referrals, getting help with authorizations for other providers outside of the area. Those relationships are already in place, and there would be no disruption to any of that. Further, like Jill said, we needed to make sure that we kept the benefits just as they are. Well, Sanford Health Plan has been comfortably managing those benefits and adjudicating those claims for the last 2 years because of your ND-PERS involvement. So again, minimal disruption is the best thing I bring to you today when we talk about the Sanford Health Plan offer. Further, I've given you a 24-month rate. We're talking about a 0% for the second year. The idea being that would get you safely past what would be your next biennium renewal with ND-PERS. So we wanted to give you as much security as we could going forward on the premium because it's an awful lot of money. But again, the most important thing is that we not disrupt your members who are already treating with and involved with Sanford Health Plan. So again, thanks a lot for having the meeting today and inviting us to talk.
Thank you. I want to thank you both for doing a plan for the city of Fargo. That was quick timing in which everybody brought it forth to us. You're both great organizations, and we're really pleased with that. On this particular vote, I do have a conflict in a sense that I'm a physician and I actually participate in both plans, so I just have to put that out there. I don't negotiate my rate with my manager. My manager does the negotiation, so I have no idea what I get paid as far as rates from either party. So I just would need to put that out there for the commissioners to understand. Do I have a motion?
Yeah, Mr. Mayor, I thank you for your acknowledgement of that, but I don't believe it would be a conflict given the situation. And we all read about marketplace and competition, and this is certainly a black and white issue as far as the rates. And from what I understand, the employees, and I understand the report about transition and folks that are used to the system, but healthcare insurance is on everybody's minds. And so when you look at the uniqueness, I think if I could use that word, that our age group and the actuarial allows for good price competition to come in and make these proposals. So I look at it as an efficiency perspective. Our employees are not losing any benefits, and it's significant. So with that, I'd move that whether the recommendation, and I don't have my glasses on, move to Blue Cross Blue Shield effective January 1st.
Is there a second?
Second.
Any further discussion? Commissioner Strand.
Thank you. I just have a couple of questions. I don't know if it would be Jill or Bruce Grubb or whom, but this will have a good impact on our budget for 2018 if this were impacted or this decision were implemented. We would have a nice little cushion that we didn't anticipate. Bruce, is that, or Kent, in the 2018 budget?
John, I don't want you to think of ways you can spend that money.
Well, I'm already working on it.
I second that.
My left wing side's kicking in.
I know. I'm a little worried about that.
Yes, thank you. That is a great question. The monetary amount for the general fund is about $6.4 million is the total spend on it, and the estimated savings are significant. It's about a 6% saving of our entire general fund budget. That's very substantial. And yeah, with that in mind, I would hope the finance team would get a whack at trying to preserve and manage this savings, because it clearly is a budget advantage, and there are several irons in the fire, if you will, with our current budget situation. You know how tightly we wound that down at the end of last year, and certainly there would be discussions about how that would be merged into future budgets.
Kent, if I might continue,
Yep.
with the notation of with Blue Cross a 7% cap already in place for 2019 and a 0% for Sanford's proposal. Have you calculated out that, just so we see the numbers? Best I can tell roughly looking, that's still a significant savings, but do you have that in front of you, how much that would be?
Well,
I calculated it, for 2019, if it was the cap at 7%, it'd be 7 million.
7 million?
Yeah.
Okay. Last, I have a question maybe for Jill, if I do.
Over the CFO?
I've had one city employee reach out to me and wonder if during this change, if we would consider contraceptions for women. Apparently, that's not covered in our current proposal or policy, I believe. And has that been looked at, or is it a need of the city, or in our working groups?
That has not been a point of discussion with receiving the quotes. I would think if coverage were to be added, that would not impact the grandfather status, because that would be an added benefit, correct? So that certainly could be a point of discussion.
Thank you, and that's just taking a call from one of our city workers, and
Sure.
yet I appreciate the question
Jill,
being
can we
raised.
look into that and report back to commissioners? Because it'd be a cost-benefit increase. We just would have to look at the cost.
Sure, we can take a look at that.
With our young population, that may be something.
Just, if I may, just add to Kent's comment, this signifies a 6% reduction. You know, what I think has not been reported very thoroughly is our 2018 budget. We reduced spending and overhead by 5%. And so, you know, what we decide to do with the 6% savings that will be to the bottom line in 2018 for 2019, we all know the discussion on, you know, property taxes. Collectively, we'll have 11% decrease in 2018, 6% here, and the 5% we consciously chose in the budget for 18. So I just think that's an important point to make.
Lastly, I had some years working with the school district on their health insurance committee, and saw a lot of years of these discussions. I don't recall ever seeing a year like this where we had this type of a turnaround, where we had projected savings coming at us in the climate we're in economically for healthcare delivery. So it's really, really significant to have this come our way to provide us these savings, and hand in hand with that is an appreciation for the providers who've been there and who've been delivering services. But it's pretty compelling to look at this type of a savings to pass on without a compromise in coverage. And with the economy going the direction it is of higher costs, typically I just really acknowledge our staff and everybody involved for working at this to the point where you're able to bring something to the table that's so substantial.
The other thing is, it's a big win for the employees. So I think a lot of the employees would appreciate the fact that the decreased premium costs, so that actually is more money in their pocket. So I think that's one of the things we really saw with the two plans, is to look at that. I think that Sanford has excellent care, and provider care has excellent facilities throughout the community. And as they told us, as Jimmy told us, they will compete for that market. They'll compete for patients to see them, and they'll be in that market. And I'm sure they'll come back in 2 years and compete again for this market and continue to improve their service. So we're very pleased that both of you have stepped up to the plate for us. This is a great savings for the city of Fargo and the employees, so we appreciate that by all parties involved. Any other discussion? Roll call vote, please.
Grinberg.
Aye.
Strand.
Yes.
Mahoney.
Aye. Other two commissioners couldn't be here today. That's the reason they're not here today. So they are informed of the issue that we have before us, but they were not able to make it. Any other business?
Move to adjourn.
Is there a second?
Second.
All those in favor say aye.
Aye.
We're adjourned. Thank you.